in the United States. They actually missed part of the diagnosis that the medical team here got correct. And if I had had the surgery in the United States, I would have had to have a second surgery. After the surgery, next day we did some walking. The second day I was able to walk up and down the hallway. I am very happy that I came here. My name is Dr. Frederick Stewart. I live in Florida. I work as psychiatric physician assistant. I came here to have my back fixed. I went to quite a number of surgeons in the United States. First started last February. I'm 62 years old and I decided to try and lift something I shouldn't have tried to lift. About 2 days later, I had pretty severe back and leg pain. I've worked in neurosurgery before. I was hoping that it would go away with exercise and physical therapy, but it didn't. So I started to look for options and eventually arrived at the conclusion that I would need surgery. It started to affect my life fairly quickly. Within a week of me injuring myself, I was unable to lift anything. Besides my job, I have several projects that require me to lift heavy objects at times. Because of that, I had to hire extra people on, and it cost me a lot of extra money on the projects. So gradually leveled out, but it never really got significantly better. So I was aware of medical tourism, so I started looking at different places, including Mexico, Poland, and other countries. The reason that I decided to come here was multiple reasons. The first of these was that I looked at the Google reviews for the hospital, and they were exceptionally good, mostly 5s. A lot of places there were nowhere near that. Having been in surgery before, I am well aware that people don't get that kind of result in general. The second was price. In the United States, this operation would be certainly 5 to 6 times, maybe 10 times as much money, and the insurance companies are unlikely to pay for it. So that figured into it, and by the time I calculated how much the flight would be and the treatment and the fact that the reviews were fantastic, I decided to come here. My first contact with the doctor and the medical team was excellent. I had already been to see 2 neurosurgeons in the United States that I knew quite well, actually. They, aside from the price issue, they actually missed part of the diagnosis that the medical team here got correct. And if I had had the surgery in the United States, I would have had to have a second surgery, which of course would not have made me happy.
Hello everyone, I am Dr. Yunus. I am an orthospine surgeon. When our patient Frederick came to us, he was complaining of pain radiating from the lower back to the leg. Initially, Frederick had come to us seeking endoscopic spine surgery. However, during our evaluation at our clinic, I mentioned that he had instability in the spine and therefore needed stabilization surgery. Because his only issue was not spinal canal narrowing, there was also lumbar spondylolisthesis too. Therefore, if we had only performed endoscopic decompression, his complaints would not have improved. In the end, we decided to perform robotic spine surgery for stabilization.
When I came, I was expecting to do an endoscopic discectomy at 2 levels. What the surgeons explained to me after doing the second MRI and me telling them what my symptoms were, which is the same thing I told my doctors in the United States, was that discectomy alone would not have taken care of all of the symptoms. So again, I am very happy that I came here. I was aware of the robotic spine surgical system before.
Robotic surgery offers some advantages, providing a safer surgical option for the patient and for us. In spinal surgery, the most feared complication is neurological injury. These neurological injuries can lead to sensory and motor loss in the legs, and this condition may be permanent. Before the surgery, we took Frederick's lumbar CT scan. We uploaded these images to the robot's planning software. Later, we planned the position, length, diameter, and angular configuration of each screw. Later, we loaded this planning onto the robot. During the surgery, the robotic arm approached to the spine according to our planning.
After the surgery, I didn't even know I had the surgery. I had no recollection of even going into surgery. But all of the pain was gone, so it was wonderful. The next day, afterwards. We did some walking. By the second day, I was able to walk up and down the hallway with none of the pain that I had formerly in my legs and buttocks and low back. I really didn't seem to need much therapy because all of the pain was gone.
The surgery was very successful. Frederick walked on the floor at the same day and was discharged on the post-operative third day.
My treatment here, compare this to the United States, much better. There's something that I should tell you and that would be important to most people. This whole process here took maybe 2 days or less than 2 days to get MRIs, X-rays, blood work, all the. In the United States, best case scenario would be 3 to 4 weeks at the best, if they okayed the surgery, which they probably wouldn't. The staff, the physicians here, I feel are more caring. I think the nursing staff has been more attentive. And in the United States, if I were to press a call button, it might take half an hour to get a nurse to come in the middle of the night. My nurse was here usually within 30 seconds to 1 minute. Clearly the staff is well trained. The hospital is very clean. I couldn't be more pleased. I got picked up at the airport in a limousine. That would never happen in the United States. Maybe if you were the president, but otherwise not. My plane, Lufthansa, was 5 hours late and the chauffeur waited for me the extra 5 hours. It was great. So yeah, I am extraordinarily happy that I came here. I would absolutely recommend coming here. I live at the beach in Florida. I have not since February been able to walk on the beach every day because of the pain. Just getting back to that alone would be wonderful. As far as work, it has affected my work, so now I can get back to doing what I normally do for work.
On the 5th post-operative day, he asked me to take a city tour in Bursa. Frederick left Bursa happy. Of course, this outcome also made us happy. I wish him healthy days.